review Griffin, medication administration, injection site locations. So we'll start with the deltoid, which is for intramuscular injections. Start by finding the acromion process. And you'll go 3 fingers down from it to find the top of the deltoid. About halfway down the arm, you have where the deltoid inserts. You have 3 fingers up from there. This area here will make a triangle. Within that area, that is where you'll give the injection. Being intramuscular, it'll go in at a 90-degree angle. Also on the arm, we have the dorsolateral. This is for subcutaneous injections. It is typically given on the lower half of the arm. You'll find the acromion process of the elbow. We'll go 3 finger lengths above that. And where the deltoid inserts, you'll go 3 finger lifts below. And this area here, a little more posteriorly, is where you'll go, and you can pinch up the fat tissue, and you can either inject at a 45 or 90-degree angle, depending on the amount of subcutaneous tissue that you have right now. Next, we'll be going to the abdomen, which is for subcutaneous injections. The abdomen is real good for when you need to do repeated injections. So you'll be going a roughly 1.5 to 2 inch area around the umbilicus, not going any further above than the costal margin, no further below than the pubic area, and no further on either side of the anterior superior iliac spines, which are here. And this will give you roughly a U-shaped area around the umbilicus to give your injections. And within that U shape, you can give sort of 3 finger lengths injections within each area for that repeated injection, so you're not continually going in the same spot. Next, we'll be doing the ventrogluteal. You'll lie on your side. You can have the patient lying on their side facing towards you. This is the preferred site for intramuscular injections. To find it, you'll be looking for the greater trochanter. So you'll place your hand. You can have the patient move their leg to feel where it inserts it. You'll then have your thumb place the heel of your hand on the greater trochanter. Have your thumb facing towards the groin or umbilicus area. Have your first finger on top of the anterior superior iliac spine. The rest of your fingers spread out along the iliac crest. And this little V shape is where you'll be going for the injection. You'll palpate to make sure you have a good muscle there and that you're not hitting a bone. If you need to, after cleaning, you can place your alcohol swab for this location so that you can then reposition your hand to see where to properly give the injection. Being intramuscular, you would go in at a 90-degree angle. And finally, if you lay like that, the last location is the vastus lateralis, and this is found on the leg. This can be for either intramuscular or subcutaneous injections. So to find this, you take one hand above the knee, and then one hand at the greater trochanter downwards, and then you have this sort of box here that makes up your vastus lateralis. You want to ensure that you do not go any further up than midline of the leg and no further on the side than midline of the side of the leg. And this gives you a large rectangular area of muscle to give the injection, and going a little further on the side is where you can get that good bit of subcutaneous tissue for the sub-Q injection. And those are all of the common locations that we give an injection.